welcome to my channel. I've been covering a few topics of importance to both parents and physicians, and in this quick video I'll be discussing why we should avoid using antibiotics in diarrheal illnesses, especially in early infancy. Antibiotics usually are needed for bacterial infections which don't clear on their own, and most diarrheal diseases, if at all it's a disease, is due to viral infections. Of course, we have the rotavirus vaccine for diarrhea in infants, and rotavirus diarrhea is an important cause which is now reducing because of this vaccine. The other important aspect here is most of what we think of as diarrhea is not really diarrhea. It's just a change in the stool pattern of the babies, which is variable in the early infancy. Part of it is due to the relative lactose intolerance, which I have stressed many times that it's related to the feed pattern, a possible element of overfeeding. The lactase enzyme needs time to upregulate, and during that time the little loose stools may happen. Changes in the diet of the baby when you're introducing juices, for example, that may cause a little loose stool. When you're traveling, the gut bacteria change. When you have had an antibiotic for any reason, the stool pattern changes. So all these play a role in the stool pattern of the baby. So first of all, decide whether it is really a diarrheal illness, whether it is a change in the normal stool patterns. If the child is well, if the stool is a little watery, frequency has increased but otherwise doesn't cause any discomfort, there is no fever, most likely it is not a pathologic diarrhea. The other important factor is that most of the viral infections that cause a cold in babies, like a common cold, can be associated with some loose stools. The same applies to some pharyngitis as well. So viral illness due to whatever reason may cause loose stools, and this tends to settle down as the illness tends to improve. So these are situations where you definitely don't need specific treatment. Monitor the hydration, replace the fluids. Giving extra fluid is not going to harm, but if the loose stools are high in volume, you need to correct with oral rehydration solution. You can refer my earlier video on diarrheal illnesses as well. So oral rehydration solution is nothing but a combination of water with electrolytes. So when we have loose stools, we lose not only water, but we also lose electrolytes like sodium and potassium, and we need to replace them. We also have a little bit of glucose as supplement. Reduced appetite is part of most of the viral illnesses as well, and the diarrheal diseases are not an exception. If it is an acute gastroenteritis, usually it starts with vomiting and diarrhea. If it is a food poisoning or a dysentery like infection, it may have fever, you may have tummy pain, and you have blood and mucus in the stools. I have mentioned previously that if it's blood spotting in the stools, a little bit of mucus in the stools, it could be milk protein allergy as well, so think on those lines, or food protein induced enterocolitis or FPIES. But if the fever is there, it's acute onset, the child has abdominal discomfort and other family members are affected, it's more likely there is dysentery. So bacillary dysentery is one of the reasons you may consider stool testing for Shigella or other species, and we may consider antibiotic treatment if the child is young and there is high fever. So both Salmonella and Shigella are bacterial infections which may need antibiotics in the younger age group but not in the older kids, where they are self-resolving. Hydration is important, symptomatic treatment is important here as well. And antibiotics have a big role in changing the gut microbiome, and now obviously it's not good to have antibiotic exposure unnecessarily, and that's why we should avoid. Testing the stool for reducing substance is also not of benefit, because the secondary lactose intolerance or the physiologic lactose intolerance does cause a positive reducing substance. It doesn't give you any additional information to what you already know. So don't test the stool for reducing substance. Don't stop breastfeeding for whatever reason. Continue breastfeeding, encourage breastfeeding. You can reduce the volume of milk and you can reduce the frequency of feeding to reduce the stool. If you are giving juices, avoid juice intake. You can give fresh fruits because it includes fiber as well. If you have come past the weaning age, yogurt is okay, but reduce other milk intake if possible, and you can give more of rice puree and pureed potato and so on. So we can easily overcome these by proper monitoring of hydration, supportive treatment. Antibiotic is not needed in majority of the situations. I hope this is useful. Please share this information. Thank you.